Welcome back to the show Talk with Your Doc, and we are here today with Dr. Ayman Hassan discussing about the stroke. Dr. Hassan, you were mentioning about calling 911, and it is very important for us to call it as soon as possible, because every minute of the stroke is it causes millions of stroke neurons being dead.
We have the acronym also, time is brain. So
time is brain.
Yes.
So we have to call 911. But while 911 is coming, do we have to do anything to the patient?
Like what we encourage is to make sure that the patient is safe. So some of the patients sometimes do not realize that they have these symptoms. So please make sure that they stay in place. Don't try to walk around. Okay. Some of them may have visual problem, like they miss part of the peripheral field and visual field, and they may end up hitting things or falling down. And this may cause further injury. And if they end up like having some kind of bruise here or there, they may not get the medication because it increases the bleeding risk.
Right.
So it's very important to make sure of this. Gather as much as possible from the history of the patient, past medical history. And the most important question we ask is when the patient was last seen normal. Yes. Because there is wake-up stroke that the patient slept and he was last seen normal last night, and then when he woke up, he had the problem. If this is
it normally somebody gets this stroke symptoms early in the morning? Is that very common?
Not very common, but it happens. There is a wake-up stroke, and now we are looking into a way to administer this kind of medication to take the clot out.
So what is the age group in which you see the stroke?
Actually, we know that age is a risk factor by itself. So the more advanced age, the more risk of a stroke. But the thing is, some of the younger people have other stroke risk factors like diabetes, hypertension, obesity, smoking, consumption of alcohol, obstructive sleep apnea, or they may have some cardiac condition that put them at higher risk of a stroke, or even very young people who use birth control pills, sometimes it may cause a stroke.
So young, you mean what age?
We have different ages in the stroke service. Like sometimes we see patients in their 40s.
40 years of age getting stroke.
Who have what we call vasculopathy, like they have a lot of vascular problem, secondary to all the risk factors that I have mentioned. But the most common age would be around between 60 and 70.
Okay, but even 40s can also get stroke.
Yes.
If they are prone to risk factors, which you just mentioned. So risk factor you mentioned are the blood pressure, right?
Yes.
And then smoking you were mentioning about. Can you please tell us more about smoking and the stroke?
Smoking is a risk factor for all vascular disease or disorders, and this includes the heart attack, the arteriosclerosis, or the hardening of the arteries that put the patient at risk of stroke. And this is true for the arteries outside the head or inside what we call extracranial or intracranial arteries. And if this is the case, they may end up with vascular problem, including a stroke or bleeding.
Yes. And diabetes and blood pressure. So it is very important to control the diabetes and blood pressure.
Correct.
And avoid the smoking at all. Now, how about the lifestyle? People who are not physically active, sedentary lifestyle, are they risk factor for the stroke?
Now, many people are talking about like sedentary life or lack of exercise as being the second smoking. And exercise, we do promote exercise even after a stroke. Actually, there is a program called Most Move on after a stroke, which is available here in Thunder Bay.
So if we really are careful about our blood pressure, blood sugar, have physical exercise and avoid smoking, probably we can prevent the stroke.
Sure, plus overweight and plus not drinking in excess.
Right. Now, suppose somebody gets the stroke, what are the complications associated with the stroke?
Like in the hyperacute stage, most people may have or at risk of swallowing problem, and if this is the case, they may end up with some aspiration pneumonia.
Pneumonias,
so, yes, inflammation of the lung because of the chemicals going the wrong way. And the other one would be clots in the legs, like DVT. Of course, if they are there, like if they have one of the disabling stroke that cause them to be in bed for a long time, they may end up with bed sores and other problem too. Like it depends on the type of a stroke and how bad is it.
Right. So like hemiparalysis. So if one side of the body becomes completely paralyzed, right?
Yes.
So how often it takes to come back to the normal once the body is paralyzed?
It depends. Like we know that 30% of the people who receive the clotbuster improve within less than 90 days. Some of them improve in few hours actually.
Okay.
So we know that 10% do very well and have no residual deficit. 25% have minor disability, 40% have moderate to severe disability, and 10% have severe disability, 15% die from a stroke within the first year.
So those patients who have a long-term disability, the reason may be because they came late to the
It could be,
hospital?
this is one of the reason. If we couldn't deal with it, or it may be a recurrent stroke because they keep going back to the same lifestyle without any changes. And it could be that they had a major stroke that which can happen in about 10% of cases, that one of the major arteries in the brain is blocked and the patient presented after the time for TBA or even for taking the clot out surgically.
Right. So now once somebody has a stroke, when they come to the hospital, what investigations do you do on those patients?
Are we talking about the hyperacute stage, like they
Yeah.
called 911 and they came?
They came, yeah.
Once they came, usually the EMS staff, the paramedics can even give pre-hospital alert that a stroke is coming. And once the patient arrives, we activate code stroke. So the lab will be taken immediately to make sure that they don't have any bleeding tendency or risk of bleeding.
Okay.
CT scan will be next on table, so they will go to the CT scan immediately. The emerge physician will see them immediately, and the stroke team, including the stroke physician and the clinical stroke nurse, if they are around at the time.
Okay, so once they come to the hospital, they undergo the series of investigations which you mentioned, at blood and CT scan and MRI. Then what happens next?
This usually takes less than 30 minutes,
Okay.
and we come to a decision whether or not this patient is a candidate for the clotbuster, and if he is, then we give the medication, which is usually infused in about an hour, and then the patient is monitored in the intensive care for another 24 hours.
Is there any role of surgery in the treatment of stroke?
Yes, in some cases, if they have like a large clot that usually do not respond even to the clotbuster, affecting one of the major arteries in the head, there is now the endovascular treatment option, where the neurosurgeon or intervention radiologist or neurologist go in with a catheter, and they can pull or retrieve the clot.
Oh, so they can pull the clot and open the blood vessel.
Correct.
Right. Now, how about the hemorrhagic stroke? You were mentioning about that there might be a bleeding of the blood vessel. Does it need a surgery, or?
Again, this would depend. Like if the bleeding is because of hypertension, a small size, most probably it doesn't require surgery.
Okay.
If it's in the posterior part of the head, like in the cerebellum, and causing some kind of pressure on the brainstem that may affect the consciousness of the patient or their breathing, then they require decompression, and this is when we consult the neurosurgeon for all cases of intracerebral hemorrhage anyway.
Right. Thank you, Dr. Hassan. We'll take a short break and we'll come back.
Sure.
Please stay back for the last part of the show. Thank you.